This is State Representative Tom Morrison, and I am once again joined by Dr. Sue Nelson, who is Vice President of Physician Operations at Northwest Community Hospital in Arlington Heights. So let's just start out with an update of the hospital. Dr. Nelson, so what has transpired since last week? You had mentioned that there's an anticipation of a surge this week. What's the status?
So, like we talked about last week, and thank you again for having me, Tom. I really appreciate the opportunity. As we talked about last week, the situation is still dynamic. You know, we're keeping an eye on a lot of different types of predictive models that give us an indication of what the total cases we might expect to be here at NCH, the number of cases that might require the intensive care level monitoring or ventilators. What we do see this week compared to last week, we did expect to see a surge over the last several days, and really we have not seen that at this point. I know that on the daily briefings from Springfield, which you see as well from the governor, the number of new cases in Illinois has appeared to level off a bit and actually decreasing to some degree. We continue to maintain our level of readiness here. Some of the models are suggesting there may still be a surge in the future. So we continue to be prepared for that, just in case.
Okay, that's good to know. And we addressed this a little bit last week, but talk about some of there are ongoing here's a question that just popped up. Will there be impacts to scheduled elective procedures? That's what I was going to ask you. We had several questions from people who had conditions that it was borderline emergency. And so if you could address what should people do if they have one of those conditions where normally they wouldn't even think twice about just coming to the hospital, but now, given this situation, there's a question.
Right. Well, NCH, like other hospitals, is following the recommendation by the Surgeon General and the CDC and have been deferring any type of elective, non-urgent surgeries or procedures since early in March. I'm losing track of the exact day. That would mean cases that would have been elective. So say I was going to have a hip replacement or something, that has been deferred and will be rescheduled at some point later when we get past the current emergency level of preparedness. If patients, the hospital though is still prepared and taking care of patients that have urgent or emergent conditions that occur. If I have an appendicitis or a gallbladder condition, those surgeries continue to go on. But anything that can be deferred is being deferred for a couple different reasons. Primarily, it helps us reserve or maintain and protect the use of the PPE, which you know is very vital to healthcare workers. It keeps operating rooms, ventilators, ICU beds available for the potential patients with COVID that might need those resources. So that's the reason for the deferral. I know it's hard for people that are waiting for procedures that they have been preparing for a while, but that's we are still maintaining that position.
Okay. And again, if you could just address, I've had several questions about capacity at Northwest Community Hospital in the ICU. Where do we stand right now?
Yeah, so I thought we'd give an update compared to where we were last week. We currently have 38 COVID patients in the hospital and 28 other patients that are considered people under investigation, which means they may have symptoms that could be similar to COVID, but we're testing them to identify whether or not they are COVID patients. We have 24 patients in the intensive care unit. Altogether, we have 66 ICU beds available and a plan to add additional ICU beds in an overflow or surge capacity if we need to. But right now, we have 24 patients in the ICU. So that's an indication that we are still in very good position in terms of availability of space and capacity. Of the ICU beds, 15 of those 24 patients are COVID patients. 10 of the patients, the COVID patients, are on ventilators in our in our intensive care.
Okay. And also subsequent to our talk last week, I heard on the news that doctors and medical staff have been trying out, just different methods for treating COVID patients. One was that they are now putting patients on their stomach Could you address, that and just other things that you and your colleagues are learning in dealing with those who have a severe infection?
Good question, Tom. So the infection with the COVID-19 virus predominantly presents as respiratory conditions, cough, shortness of breath, and can progress to pneumonia. The pneumonia obviously is an infection in the lungs, which makes our lungs less efficient at extracting oxygen from the air. Oftentimes, these patients require some type of supplemental oxygen that can be delivered by a nasal cannula, a face mask, or in situations where their oxygen levels continue to be lower than is needed, obviously, then being put on a ventilator is a strategy that we have. What we're learning about the virus, and again, I really defer to the intensivists and the experts in the area for these critical patients. What we've been learning is different about the virus and different techniques for optimizing oxygenation, which may not require putting people on a ventilator. And part of that includes proning the patient or putting the patient on their stomach to assist with breathing. And this seems to make a difference in terms of improving oxygenation levels, and it has been shown to potentially delay or eliminate the need for ventilators in some patients.
Okay, good. We had a number of other people ask about antibodies testing. Do you have any update on that?
That's another really good question. Very common amongst your constituents and my patients is that once a patient has had an infection, they develop antibodies, and the antibody testing for COVID is not currently available. It is being tested at some of the national centers. Once that's available, obviously we'd be able to test patients to identify whether or not they've had the virus, whether they have immunity to the virus, but it's not currently available at this point.
All right, and then we also had several other questions about the hydroxychloroquine. We talked about that last week, but is there any update on treatments from some of the antivirals to, well, I guess this would be considered an antiviral too, right? The hydroxychloroquine. But then there was some other drug that was being tested, REMS. I can't pronounce it. REMS.
Yes,
It's
that's
that
it.
Gilead Sciences drug that starts with an R.
Right. You can think of a number of different treatments. Some of the treatments are oxygenation, which we talked about. The antiviral medications the antiviral medication is being trialed and is in use for the critically ill patients. The hydroxychloroquine, like we had mentioned on last week's call, originally is an anti-malarial medication, but it is also used for a number of other autoimmune related illnesses, different types of inflammatory arthritis. There has been benefit identified with the use of hydroxychloroquine in critically ill patients with COVID-19. And so it is being used on the inpatient setting for patients, sometimes in combination with other medications. It's not being used in an outpatient setting. It should not be used prophylactically or as a preventive medication for patients, healthcare workers, or otherwise, for a couple different reasons. First of all, we don't have evidence that that is beneficial in that setting. And second, other patients that do use this medication for significant illnesses, it can create a shortage of the medication. So people who actually do use it and are benefited by it would not have it available.
Toward the end of our talk last week, you mentioned that the hospital will accept donations of things like face masks. I had a constituent reach out and she just wanted to help in some way. She was going to start making these masks. I know others are making masks. And if someone wanted to donate, whether it's the traditional PPE or cloth face masks, which again might not be used by those frontline medical professionals, but people who are at the hospital anyway could use those. It would be helpful. How would someone donate some of those things?
So yeah, it's really continues to be very heartwarming. The community has been so supportive, and as I mentioned last week, we're here to support the community, provide for the needs of the community, and in this case, it's just really so wonderful to see the community trying to reach out to find out what they can do to help us. We continue to look at the use of PPE and the availability of PPE. We talked about masks in particular, donation of N95 respiratory masks, surgical or procedural masks, and the cloth masks. And we are using cloth masks for non-direct patient care employees. Again, and as the CDC has recommended, all people should have a cloth face mask when they're out of the house to try to reduce the spread of the virus in the community. So yes, masks are really an important component to that, and we welcome the donation of that and have really seen some really creative craft work done from the community members. We also continue to be in need of isolation gowns. This is another component of the PPE that is in critical shortage on a national basis. So companies that have, maybe because again they're not as actively at work during this stay-at-home period, but if they have these isolation gowns or plastic gowns that could be used by healthcare workers, that would be another area. In general, you can look at the nch.org website. There are different links there that go to the identify areas that would be very welcome donations. So we would appreciate that very much.
Okay, we just had another question come in. Terry wants to know, and again, we talked last week about soap and water, hand disinfectant, ways to just prevent the spread of the virus. But as the weather starts getting a little bit warmer, what do you think what impact will that have on the transmission rate of the virus? And are things like sunlight, UV light, heat, could that kill the virus? Any truth to that?
Those are all really good questions. What we do know is the most important thing to do is wash your hands. Soap and water is a very effective way to remove the virus from your hands. And then with the whole idea of not touching your face is that your hands can become contaminated because you're touching different stuff and then you're touching your face. I don't know that, there's a lot that we're still learning about the coronavirus and whether or not it's seasonal like influenza. Influenza has a tendency to travel or spread more effectively in winter months in that dry air, but we really don't know as much about the coronavirus yet, about the impact of those types of factors. So the most important thing to know about the coronavirus is that it's spread through respiratory droplets, which means cough, sneeze, talking, can spread into the air. So by staying that 6 feet away in terms of social distancing reduces the risk of transmission to another person or to you from another person. Covering mouths and faces with coughs and sneezes, using the cloth face masks, and then again, washing our hands and wiping down surfaces is the most important thing that you can do to protect yourself and others.
What about, do you have any advice for someone with MS? How would the virus affect someone? Are there extra steps that someone with MS should have to take?
Oh, that's a good question. So someone who has MS or multiple sclerosis, it's a neuromuscular condition that can create additional challenges related to weakness. That would be in that category of underlying medical conditions that would put them at greater risk if they became infected. So patients who are at greater risk, whether that's MS, diabetes, chronic lung disease, heart disease, those individuals should take additional precautions to protect themselves. And again, following the same recommendations that the CDC has recommended in terms of following the stay-at-home order, maintaining social distancing, and back to the good hand washing and wiping down surfaces.
Okay, thank you. Bryn wants to know about, well, early on there was a shortage of ventilators, and so there was some discussion about, how do we provide oxygen for people who, if there is a ventilator shortage. So Bryn wanted to know about CPAP and BiPAP machines that might be used, I guess, if there is a shortage. Is that something that's even viable? Because apparently there are some devices that are not being used, and maybe in a emergency situation, if there's nothing else available, could a BiPAP or a CPAP machine be used?
Well, that might be, above my technical expertise. But I do know that we use BiPAP in some situations to try to avoid or defer or delay the use of a ventilator if we can provide additional treatment in the meantime to improve oxygenation. Here at Northwest, we have, I think I had mentioned earlier, we have 20 patients right now on ventilators. We have a total of 72 available here at the hospital. So for us, in terms of our planning for our surge plan or potentially increased volumes, we feel like we're in pretty good shape right now.
Okay, and then what about, okay, so another question about what does the hospital's new normal look like once we are past the crisis? There have been a ton of deferred procedures, and so what does that look like? Is there going to be a rush um, on procedures that again were maybe borderline? Who's going to determine the order at which these procedures go forward?
That is a really good question. I think that all of the healthcare organizations in the area nationally are looking at that as what do things look like post-COVID. Our ramp-up plan back to getting close to normal or what might be the new normal is to look at all these cases that have been deferred over the past 2 months and identify which ones really need to be prioritized. And so things like cancer treatments or treatments related to conditions associated with increased pain, those might be ones that would be reprioritized to start to be the first ones that we get back to. We're also looking at how, as we ramp that back up, we anticipate that for some time we'll probably need to continue to be doing symptom monitoring, temperature monitoring symptoms, maintaining social distancing, looking at how do we reintroduce the ability to provide care while still be compliant with guidelines that would help us reduce the risk of community-based spread over the next several months.
And another question or a topic that came up. A couple months ago, I was planning to host a blood drive before we knew that this was a crisis, and it looks like those details are coming together. Can you address the blood supply issue? How do we sit in terms of healthy blood supplies?
So I would always encourage blood donation. It is always needed. I always wish that we had more than we have available. So that is a wonderful thing that people can do on behalf of patients that need it, on behalf of care organizations. There are a lot of opportunities if you either through the Red Cross or you probably whoever you're coordinating with, Tom, to be able to provide blood transfusions. If you're feeling healthy, if you're feeling well, we would encourage people to participate in those blood donations.
Can a person contract COVID-19 from a blood transfusion? If people can transmit the disease without showing symptoms, how is the blood supply being protected?
That's a good question. I think that I will actually, maybe we'll follow up on that with our next one. I think that we are always screening for what we know how to screen. We screen patients before they donate blood to be sure that they're feeling well. There's a screening questionnaire about, as for any blood donation, about the potential contacts, a person who wants to donate blood to be sure that they don't have recent contacts that might put them at greater risk. I think another question related to donation in follow-up to some of the other questions that your constituents had to do with plasma transfusion. And NCH is currently involved in the use of convalescent serum for treatment of patients with COVID. It's being coordinated through the hospital. You can also look at our website for information related to that. This is primarily for patients who've had COVID, who have previously tested positive and are at least 28 days since their positive test, or when they develop the symptoms, or if they have had a negative test since then that shows that they're negative for the virus. That serum that can then be used to help treat patients who are acutely ill.
Okay, great. All right, well, why don't we wrap up here? And again, if you're watching this video later on this afternoon or in subsequent days, go ahead and write a question in the comments section. Dr. Nelson, you were going to provide a list of resources. Do you want to just go through that list right now? And then if there are any final questions, we might be able to get to those.
Yeah, I think that maybe even just listing the website or the link of Give COVID-19 at nch.org, you can still access that through our regular website. but it lists the areas that we're looking at in terms of critical need for the hospital, for the staff, for the benefit of the care workers here that really just get such joy out of community-based support. So anything from PPE, like I mentioned about the isolation gowns, the sanitation wipes or alcohol wipes, masks, gowns, gloves, all really very, very helpful. But it would all be listed on that page of our website.
Okay, and that just reminds me of another comment I had after our last talk. So you were talking about the difference between N95 respirators versus surgical masks. And I had a constituent who wanted to provide N95 masks, but wasn't sure if they were up to standard or not. I had put up on a graphic that there are fakes. Unfortunately, some people take advantage of a crisis and might try to pass off something as legitimate when it's not. So this person wanted to donate these masks, but wasn't sure if they could be used or not. How would the hospital determine that, or what should people do if there's a suspect or if there's suspect equipment?
Well, we definitely want to make sure whatever equipment that we're using and that we're providing to our healthcare workers is keeping them safe and keeping our patients safe. And if individuals want to donate to the hospital, we have an excellent infection prevention team and our supply distribution team. They're taking that donated equipment and testing it to be sure it meets the standards that are required to keep our patients and our staff safe. And so really appreciate that. We certainly want to be sure that all of the material that we get goes through that type of critical evaluation.
And that actually reminds me of another question I had is a constituent was ordering some, I guess, a mask online and wasn't sure what she should do. Once she receives it, how would someone know if it's safe or not? Was there some kind of a contamination in the transport, or what should someone do if they're concerned about equipment that they've purchased for their own use? Again, if they have to go out because of work, if they have to go out because of shopping or something like that.
Well, if it's a cloth mask, we would definitely recommend washing it in warm water and soap before using it. If it's any other type of mask, again, any other type of mask, surgical mask or N95 really are for healthcare workers. But if individuals had something like that, you would want to make sure that it's in a sealed container from the original manufacturer is what my recommendation would be.
Okay, and once again, things like UV light can kill the virus. Is that right?
We are actually using we use UV light processing in our ORs as our operating rooms as a way of killing bacteria and sterilizing rooms. So UV light can be used for sterilization and sanitation. I don't really know about people using that at home or sunlight or otherwise, but we do use UV light as a form of sterilization in the hospital setting.
All right, well, thank you all for joining us. And Dr. Nelson, thanks again for your time. We're so grateful. Those of us in the community, if we were to get sick, we know that we'd be in good hands with you and your colleagues. And so thanks for what you're doing and all of the frontline workers, both in our community and around the region, around the country. I'm grateful for all the supply chains, from food, truck drivers, retail store workers. I think we're now understanding how much we rely on one another and how quickly things can fall apart when there is a situation like we're facing. And so we need to stand together as a community, and you're part of that. You're a major part of that. And so again, thanks again. And maybe we could do this again next week.
Yes, thank you. I mean, NCH, this is a great team to be part of. I'm glad to be part of just a wonderful group of people doing really great work every day. So thank you, Tom.
Okay, great. All right, be well and stay safe, everyone. Thanks again for watching. Take care. If you like videos like that one, make sure to hit the subscribe button and like and follow our pages so you'll stay up to date. Thanks again for watching.